And I want to thank Salt Lake County partners, residents, businesses, and community partners for leaning forward and taking this initiative seriously. We're going to present some data today that shows that we have a really high compliance now in Salt Lake County. It was less so previously, and that's very good news. And we know that COVID-19 is a powerful competitor, and it will be with us for some time. But we do have the power to reduce its harm in our community. We know this action works. We're all sick of it, but we need to continue to wear our face coverings. We also need to limit our personal interactions best we can and keep that 6 feet social distance. This is all the more important as we enter into our holiday weekend, our prized 24th of July weekend. With that, I want to make one last point. I've been asked time and time again, you know, hey Mayor, why at that point in time in June did you take this action? And I'll tell you, there was enough evidence that it would work. I'm glad that it did work, and I will continue to prioritize the health and safety of everyone in this county. I'll do it in the future as needed. I've done it in the past, and I really believe that leadership is about action at the right times. I thank my partners in helping me take the stands that I've been able to take. I thank the governor for giving us the permission to move forward. I would like to see him move up the deadline. I think we in Salt Lake County and Summit County even have some evidence now that would indicate this is working, and I believe it's time. So thank you. I'll turn the time over to David Schold. David is a critical policy advisor here. He leads on COVID-19's response and recovery effort for my office. And then we'll hear from Gary Edwards, the executive director of the Salt Lake County Health Department, and they'll each touch on data and where we stand. Thank you.
Okay, and good afternoon, everyone. My name is David Schold, and I am the Special Assistant to Mayor Wilson for COVID-19 response and recovery. Over the past 19 weeks, I have been honored to be working with dedicated and brilliant responders from public health and emergency management, as well as analysts, as we explore data sets and trends so that discussions can be informed with evidence and effect. As Mayor Wilson stated, there is evidence that face coverings are impacting the speed of the spread of COVID-19 in communities, keeping them safe and healthy, as well as protecting our medical systems. Residents of Salt Lake County, good work. Thank you, and keep it up. First, I would like to review an analysis of Salt Lake County's percentage of statewide cases, and you could go to the next slide. Prior to June 27th, Salt Lake County would comprise of over 50% of confirmed cases in Utah. Since then, Salt Lake County's percentage of statewide cases has been steadily reducing. The data captured yesterday, and this is a 7-day rolling new case percentage, shows that we are now trending in the low 40s. Alternatively, as we look at the rest of the state, they are increasing in that percentage. Next slide, please. When viewing this information from the lens of a new case count, we could see the gap between Salt Lake County and the rest of the state continue to grow. We can see a gap between the average 7-day new case count begin to develop over the July 4th weekend, where the difference between the average 7-day case was limited. Now it spans 113 cases from our capture yesterday. We will continue to monitor, but there is some interesting information to glean from this data. We know that face coverings are one of the most powerful ways to slow the spread of COVID-19. We also are conducting more tests in Salt Lake County than we ever have done before. And working through this analysis, we are seeing a correlation between face coverings and slowing the spread here in Salt Lake County. If you could go to the next slide, please. We are also working to protect our healthcare systems. With less people infected, as Mayor Wilson said, less Salt Lake County residents need to be hospitalized because of COVID. The chart, to be shown, tells a story of how less residents from Salt Lake County are needing hospitalization. This is a comparison of the cumulative hospitalization of Salt Lake County residents. And as you could see, moving towards July 15th, where the crossover occurred, the gap between Salt Lake County and the rest of the state closed. And if you move to the next slide, which provides a more detailed image, we're actually seeing a stabilization in those hospitalization counts for Salt Lake County, while we continue to see a larger increase for the rest of the state. Data is only one lens to look through, however, and efforts by our residents have been meaningful and helpful. Our efforts continue to maintain pressure on the virus, and we need to continue with that. And with that, I'm going to turn it over to Gary Edwards of the Health Department to provide some more information.
Thank you, Mayor Wilson, David, and thanks to each of you for helping us get important messages out to our community. We appreciate that. I get so used to wearing this, I forget it might be better for me to take that off. As David just displayed, we're seeing positive numbers in Salt Lake County in comparison with the rest of the state. But just saying that these trends are because of the order that was issued on June 27th wasn't satisfactory for us. We wanted to understand it better. We wanted to understand how well the order was being complied with. So if we could go to slide, thank you. Over the past few days, we've visited 44 stores across Salt Lake County, grocery, big box, and convenience stores, to observe both customers and employee compliance with the order. We also looked at a much smaller sample in both Davis and Utah counties, two counties, as you know, that do not have an order. The results of these observations further support our belief that the face covering order is a successful public health tool. If we could go to the next slide, please. In Salt Lake County, as you can see, 100% of the stores had signage. 44% in Utah County, 33% in Davis County. Total individuals, both customers and employees, wearing face covering, 98% in Salt Lake County, 68% Utah County, 83% Davis County. Customers, 96%, 53 and 74, and employees, 99, 84, and 99. These are very encouraging results. Almost everybody in these retail outlets that were visited, that were observed, and we didn't count everybody. We had a procedure for how we were doing it. But of those that were observed, almost everyone in compliance with the face covering. Now, if they had a face covering that was not covering the nose, that counted as no face covering. This had to be covering both mouth and nose. I want to thank Salt Lake County residents and employers for taking this seriously. We believe this is having a significant impact. Also want to recognize the employers from all three counties who are doing things to encourage employees to be complying with at least a recommendation in Davis and Utah counties and the order in Salt Lake County to be in compliance. This is not the end. This intervention using proper face coverings has to continue. We can't rely, however, on just this intervention. Face coverings, while effective, need to be combined with other interventions in order for us to achieve the results that we all are striving to achieve. We cannot allow the success of face coverings to give us a false sense of security. We have to combine that with continued physical distancing, good hygiene practices, staying home when ill, staying home when exposed. We have to do those things to the same extent that we are using and employing face coverings. As we do that, we will continue to see success. You're all familiar with the study that was done by 4 individuals at BYU that was released this past week. I want to quote from that. I usually don't quote BYU, but I will today. There is nearly universal consensus that masks could be one of the most powerful and cost-effective tools to stop COVID-19 and accelerate the economic recovery. We have to continue to press forward, each of us doing our own part so that collectively we make a significant impact. Again, I want to thank the residents of Salt Lake County for their adherence to the order that was issued. As we continue to do that and employ it with other interventions, we'll continue to see success. Mayor Wilson.
Yeah, we'll just take questions now for Gary, myself, or David. Anyone? Wow, we're okay.
Mayor, I've got a couple questions.
All right.
Questions for you.
Okay.
So it like all data, it may depend on how you read the data.
Right.
Okay, so as a percentage of statewide cases, you show data that the cases in Salt Lake County are making up a lesser percentage. But if you look at days before and after the order, you could argue that you actually have more cases on average after the order than you did before. How do you respond to that?
Well, I think it takes a little time. I'm going to actually let Gary kind of give you a more precise answer from a health perspective. But from my perspective, I've been schooled quite a bit by the health department, and it takes some time, both for everyone to kind of comply, and then it takes some time for symptoms to develop, and it takes some time for people, because we do know that our big concern, of course, is asymptomatic people that don't know they're carrying it. So you could see a lag between people even being aware and going in and being tested. So there's some variables there. I think there's another key point here is that we have at Salt Lake County implemented some very significant interventions prior. We went into zip codes and doubled down on our efforts to combat COVID-19 in certain areas. We recognized that the Latinx population was disproportionately impacted by COVID, as well as other minority groups. So we have been doing a tremendous amount with outreach. We're trying to address language barriers and other barriers so that we can get people tested. That's resulted in a lot of targeted testing locations and activities. Those have helped us well, but those were in place and they were sort of starting to roll by the time we put the mandate in place. So I would not guess that every one of these numbers is due to the fact that more people are wearing this, but Gary did a nice job of pointing out the compliance now. I did my own personal survey, moving around the county as we all do. For some reason, I tend to move around less than I used to, but I still move around the county. Prior, I would say 55 to 60% of people going in and out of retail establishments and other public locations were wearing, and I would agree with the data presented by Gary that we're up to 95 to even 100% compliance or close to 100%. So all that is good, and we know that this does have an impact, the requirement. How deep it is, person by person, is somewhat subjective, I'll admit.
And so just looking at numbers, so recognizing that your experts have said, we got to wait 10 to 14 days before you really know the impact. So there was an average of about 259 cases a day in Salt Lake County. These are your this is
Right.
the website. In the 10 days, after 14 days from the order, taking from July 11th to today, about 250 cases with a net decrease, average decrease of just 9 cases a day.
Right.
Doesn't seem like a big number.
I completely disagree. It is very, very, very good news. And I'm going to turn this to David or to Gary to elaborate. But what we were concerned about was that trajectory upward. That rate increase is what led to phone calls from the hospitals to me saying, can you do more? That rate increase is what literally led us to fear what could be next in our community, especially as we enter into a conversation about going back to school. So the stabilization is a very big win for us right now. I'll tell you, I'd love to see the decline. I would love to see COVID-19 behind us. A true decline at the rate that we would like. It would take a lot, but to stabilize right now is both helping our hospital system, it's allowing for the critical elective surgeries that are needed in the community, and it's allowing our caseworkers and our other folks that are intervening to breathe. And what we were really concerned about, these two can attest to it, I was asking on a regular basis, what about the multiplier? What about the multiplier? It was literally keeping us all up at night. The stabilization right now and the equalization of the count is very, very critical. And the rate decline is really what this is all about. We want to get to a rate where we see, right now we see 1 to 2%. It changes day to day on the rate of spread, but we want to see that fall below 1 because then we know COVID-19 is leaving us. That was our early hope. I think it's going to take a lot more to get us to that. What we've been able to do in this community is continue to operate. Our businesses are up and running. I drive by restaurants and see people enjoying the patio. All the while, restaurant workers are wearing face coverings. That is a big win for us. Our economic sales tax indicators are much better than we would have thought for the months that we have reporting from, and that's a good sign. It doesn't take away the challenge of someone who has had to adjust their business operations or a family member who's lost someone, and it is certainly some stabilization of our numbers doesn't take away the harm that we all face when we come up against COVID-19 directly in whatever way. But the cumulative impact on our health system is benefited by the wearing of masks, it's benefited by the mandate, and it is indeed benefited by everyone who maybe doesn't go to the big party and operates some caution with their own personal choices. And maybe that means we don't need to see that annoying cousin that we've been trying to avoid anyway. So with that, I'm going to leave that, the clarity of anything I said, or correction even to the experts here, with David and Gary.
Can I ask you one more question before we go back?
Sure.
You kind of hit on it a little bit at the end, but I know you've been pushing for this mandate before you guys were able to put it in place. If you have the governor listening to you right now and you have the mic, what is your direct message to him?
I've enjoyed my association with Governor Herbert. I think he's a very committed governor. I know he cares deeply about this state. I think in addition to epidemiologists, the World Health Organization, the CDC, we now have local evidence that this is working. I would ask, as a parent, as we go into a school year, that he enact a ban now. We know that Davis County, Utah County, our small rural counties, when we move from one county to another, as we do in this state, we're a recreation state, and we're also very connected with our economies. I would ask that he implement a ban now. There's no harm. We're all getting used to it. It's a minor inconvenience, and it has a big impact.
Well, if you have anything to elaborate on that, but it seems as if even if you take the window after the order, So you give it a couple of weeks. And if you didn't do that, if you only give it 10 days, and in that 10 days, you had a 400-plus day, your
Mhm.
biggest day ever.
Mhm.
It doesn't seem like the numbers have gone down that much. So,
Yeah, I can't argue the numbers. The numbers are there. But what we saw, Salt Lake County was on the same trajectory as the rest of the state with the surge during during June. Salt Lake County at the end of June issues an order. The rest of the state continues to go up in average number of cases per day. Salt Lake County plateaus, goes down somewhat. Okay? The only difference, well, I probably can't say the only difference, but a significant difference is a mask order. We are not going to get down to 0 with a mask order. What we need to do, as the mayor was saying, is control surges. And that's what this did. We controlled the surge, and we are seeing some decline.
so would you say that this is, rather than this narrative of this rapid fall in cases, that this is really a stabilization, as the mayor just said?
What we have seen so far is a stabilization, yes, while the rest of the state has not.
I have a question. Well, I know you guys haven't been issuing citations, and that would come from the police department. I know you guys go out to businesses and provide education. How many businesses have you had to go to provide education after getting calls that people weren't complying, that businesses were not enforcing the mask mandate?
And I'm going to let Gary reflect on that from the health department perspective. However, I need to repeat my direction to the governor because I think what I said was he should institute a ban, which would be a very bad thing. What we want is the requirement that face coverings be worn. So if I could just restate, I appreciate my relationship with Governor Herbert. I know he's a committed governor, cares very much about the residents of this state and has fought for them. He has given strong guidance to our state that face covering should be worn. We've seen that from other leaders throughout the state. I do think a requirement makes a difference. The data shows the stabilization and even a decline for Salt Lake County right now. For those reasons, and as a parent, I would encourage him to enact, to expedite his timeline, to enact a requirement statewide now. We know that people move from one county to another. We're a recreation state. We love to connect with our family members, one county to another. And I think it actually sets Salt Lake County back as we make the tough calls, frankly. And so I would ask that, given school is just around the corner, people are fighting so hard to make that work. Our educators, our teachers, our families, we're all sort of thrown right now by that journey that we have ahead. If we're able to require face masks to be worn now, I think we'll see, and in fact I know we'll see stabilization of our numbers, and that puts us in a better position to have a successful school year and move into the fall in the right way. So Gary, the question, I think is better answered in the health department on enforcement.
I don't know an exact number. There have been many complaints that the health department has received. We do have teams that were established a couple of months ago, referred to as our ambassadors. Those complaints are turned over to those ambassadors, and the focus is education. As with almost all of the enforcement that public health does, we begin with education, and that's where we've continued to focus here. As we've done that with the order, with other things, we find strong compliance. We still want to encourage individuals, if they find an employer who is not following the order, we would like to know about that so that we could make contact with them, help them understand how critical it is, and get them to come along with us and support us with this important effort to control COVID-19.
Just wanted to, and apologies, On June 27th, the day of the face covering mandate going in, our doubling rate, which is the number of days it takes for the virus to double, was 30 days. Before that, we were 50 days. So before the face covering, we are actually sliding into decreasing the amount of time it takes for the virus to double in Salt Lake County. Since then, since this has come into place, we're at 70 days. So there is a significant spread that we have been able to accomplish in our efforts. So, additionally, our hospitalization rate was in the high 6%. We have dropped to 5%. So less people are needing to go to the hospitalized that are infected. So, and our case rate increase on mandate, the day of mandate, was 2.7%. We are now at just over 1%.
Can anybody describe what do you think was the main convincer to get the holdouts, the ones that were saying, no way, I'm not going to wear it, I just don't want to wear it? What do you think was the main thing to convince them to go ahead and start doing it? And especially since there weren't any tickets or anything.
So I think there was a lot of evidence on the effectiveness of wearing face coverings that was rolling out around the time this was implemented, both from epidemiologists and experts. But I think there were also more stories being told of suffering from COVID-19. So I think the dual message of better education, COVID-19 has thrown us a lot of curveballs at every turn. And I think about the early days where literally every ball was in the air and we needed to sort them out in order to make sense of it all. Since that time, we've had a more, I think, deliberate framework, both as government, partners who are battling this, but also residents are getting better and clearer information. It became more and more clear that this tool is incredibly effective. And I think one thing that we heard going into the requirement is that into implementing the requirement is one business was saying, you know, I'm not going to enforce the requirement. Another one was, and it was creating a lot of confusion for the consumer. And I think when the requirement was put into place, it sent a very clear signal, not just to the businesses, hey, put the sign on the door, and would you please put an employee out, just as a general reminder, which I observe and I think is working, but also a reminder to those of us walking out the door, make sure you got one of these. So I think it was a combined reason. And I also think we're really a community that knows the power of collective impact. We know when we all do something together, we can change the course of our journey. And COVID-19 is incredibly frustrating for each of us. It's heartbreaking for many. And I think this gives us a little power in the conversation as we do what we can do to change outcomes. I felt as a mayor very grateful for the health department team, our logistics teams and others who stepped up and literally rallied and moved mountains to get into our communities in a different way. That felt to me to be a moment of empowerment to say, look, we're going to go into the zip code, we're going to translate the documents, we're going to have interventions door to door for people who may be afraid to be tested when they need to. We're going to reach out to our business partners and provide a financial safety net to them. The federal government has asked us to do that. We want to make sure our economic impact is as minimal as possible due to this tragedy in our community. And to me, this is yet another moment of empowerment as we as a community fight this thing.
Mayor, maybe one more question. So there was the Red Zone report last week that said in hot spots, Utah should close bars and gyms. Why haven't you closed bars and gyms?
You know, I think you're referring to the White House report. I recognize that any work done at the federal government to emphasize productive measures that will help us combat COVID-19 are a good thing. So when I saw the White House report, I appreciated the sense of urgency for our state as a whole, but all the while we've been measuring data day to day here and know where we are. And I really would, further closures are the very last resort. We will continue to manage COVID by the good faith and good efforts of our community without further closures unless we get to the point that our hospitals are being overrun. At that point, I think we have to have a community-wide conversation about what's best. In doing so, just as we stepped out as Salt Lake County and provided grants to businesses who had impacts due to the closures, we would at that time need to provide additional aid so that we can make sure our bars, our restaurants, our gyms, and others remain functioning. But right now, and I think it speaks to some of the earlier questions, right now, a stabilization keeps us out of that lane and puts us in a position where we can get through what I hope is not a big impact this holiday weekend, that we all make wise choices, that we can get through July and into August and continue to kind of be back to sort of our traditional COVID world dealings. I believe we'll be on a good enough path, at least until the school year, to not have to have those sorts of interventions.
One more question. I know you said, calling on Governor Gary Herbert to put forth a mask mandate, but what about Utah County, Davis County? I mean, these numbers, especially Utah County, only about 50% of the people wearing masks. What about those counties? You guys are one of only 3 in the whole state. Do you see yourselves reaching out to those leaders, sharing this data and trying to get it done that way? Since you said we are a recreation state, we do have people that are going to Utah County to Davis County.
Well, in the same way I would appeal to the governor, I would appeal to any commissioner in this state. These are my partners. I mean, I'm a county elected. I've enjoyed the association over the years. However, I remember a conversation I had with a rural commissioner via text in the early days of COVID, and I said, look, this is going to put this will challenge our friendship. The words you're sharing right now are damaging, and it will harm my county. If we don't take action, no matter where we live within this state, people will be hospitalized, and ultimately the heart of our hospital system is here in Salt Lake County. So one county's action impacts the well-being, not just of our county residents, but the hard-working staff members who are day in and day out fighting this. All right. Thanks, everyone. I appreciate you. The media have been amazing during this journey. You guys have shown up. I know you care about the community, and